What is monkeypox? Where does it actually come from?
So currently we're sitting at about 60,000 cases in 114 countries, and that sounds a lot, but compare it to what we saw for COVID-19 and what we know for flu.
The majority of the monkeypox cases have been reported in males.
Morbidity has been an issue for a lot of guys. Guys have had severe anal pain. They've had to be hospitalized for anal pain.
There's a religious group that perhaps is spewing the kind of messaging that is associated with a group that is affected.
The education at community level needs to happen before any disease comes into play. So this for me brings forward the issue that we do need to have public health education.
Hi everyone, thank you for taking the time to tune in on what I believe is a pertinent discussion on monkeypox. So we live in times of increased social anxiety. There's a lot of fear mongering and in fact increased social commentary around monkeypox. So let me begin with you, Jackie. Can you tell us what is monkeypox? Where does it actually come from? How is it spread? And what is particularly unique about this outbreak?
Boy, it's actually a loaded question, and we continue to learn what monkeypox is and what monkeypox isn't every day. So monkeypox is a viral infection, number one. Number two, it's called a zoonotic disease, which means that it's a virus that's maintained in nature in an animal. Okay. So what can happen is that you have natural transmission cycles of the virus in an animal species, and that's one of the questions that we don't know the answer to yet. We don't know the actual natural reservoir of the virus, although lots of scientists believe that it's certain rodent species. So that is happening in nature all the time, and from time to time there's a haphazard spillover into the human population. If this was a virus that was very jumpy, we would have many more cases. So currently we're sitting at about 60,000 cases in 114 countries, and that sounds a lot, but compare it to what we saw for COVID-19 and what we know for flu. So it tells us very close contact, mostly skin-to-skin contact. And that's the main transmission route. We know that it's not a highly fatal infection if we look at the numbers historically, but even during this multi-country outbreak, there are deaths reported, but very infrequently. We know that it's mostly a self-limiting disease, but we also know that certain patients do need more support. Some patients need to be hospitalized for pain management, for example.
So I would like to then move this discussion to a slightly more sensitive topic, and that is to deal with the reporting, the key population and the at-risk group that has been identified to be disproportionately affected by this disease. So to date, the majority of the monkeypox cases have been reported in males, all right? But moreover, the sexual orientation or the sexual preferences of these individuals have also been noted. So the question I have, and I'd like to invite you, Johan, to perhaps respond to this, is why is this detail important? Of what scientific basis does it serve in terms of case finding and perhaps the impact it might have on transmission?
So thank you for the question. I think the reason why it is important to know what population we're dealing with at the moment and who's the most at-risk population is we need to know who we need to target our education, our messaging towards. And I think this is something that we actually just discussed while the cameras weren't rolling, is the difference for me is when the HIV epidemic started, there was no internet. Now we have internet, we have social media, and I work in a clinic where we do a lot of PrEP, and there was so much misinformation about PrEP when PrEP started. So the same thing for me is about monkeypox. You know, you need to know you're dealing with adults who can go into the internet, and I think it's very important that we give people the right information. But having said all of that, we need to also remember that monkeypox can happen to anybody. Right now, MSM are just at higher risk because there's more monkeypox in their community. And something that we've discussed as well is when it comes to messaging, I think it's very, very important that we give people generalized messaging for the general population. But then don't be scared to speak to the at-risk population about certain things. I mean, if you go and read up on monkeypox, you'll see that it's a very mild disease and the mortality is extremely low, but morbidity, and I'm sure people understand what morbidity maybe means, maybe it's too big a word, is morbidity is kind of how people are going to deal with a disease. Morbidity has been an issue for a lot of guys. Guys have had severe anal pain. They've had to be hospitalized for anal pain. They had proctitis, which is inflammation of the anus and the rectum. They had swelling of their penis, genitals. So for a lot of people, there was a lot of discomfort. And coming from, you know, a place where you've been maybe marginalized your whole life, now to experience these things as well, I think we need to step back and we need to realize that these are human beings that are going through something, and we need to deal with it with enough empathy.
So for instance, is there a religious group that perhaps is spewing the kind of messaging that is associated with the group that is affected? Does the public health community then have to speak against that community to emphasize the actual science, so that to say that this group is disproportionately affected, but it doesn't mean that this is the only group that is affected. So I'm just thinking of ways going forward to ensure that we've learned from previous mistakes, and that even as we are using the internet and using these channels to bring information across, that we need to hold these institutions accountable, and that as a community that provides that data, we have a responsibility to ensure that we don't feel the social prejudices. So what does that look like?
Yeah, I mean, I think it's very crucial what you are asking, because the communication that is coming through is scientific. We need to engage with our communities prior. So I think what we've learned from COVID-19 is that it is important that education happens before these diseases come into play. Because if people understand that when we talk about at-risk groups, what are we talking about? That it could happen that we have a disease that's specifically affecting this group of people, but it does not necessarily mean that this group of people are responsible for bringing the disease into the community. We do need to have public health education, not just about cleanliness and everything else, but about diseases, how they come into existence, how do we test for them, and how are they spread.
The very act of having sex, right, involves skin-to-skin transmission. And it seems unavoidable, you know, to not have a skin-to-skin contact. So firstly, is it plausible to even speak about safe sex practices in relation to monkeypox? And if so, what does that look like?
We're still saying, please use a condom, because you can still protect yourself against other sexually transmitted infections. It might not happen with monkeypox because you need skin-to-skin contact to get it. But you also have lesions that can come on your mouth. So we're talking about oral sex, we're talking about anal sex. So in those instances, condoms will still be useful because there are other sexually transmitted infections that you can get in that instance. But also on the other hand, you know, limiting the number of sexual partners that we have. We've always advocated for that, just for all the sexually transmitted infections in this instance as well, that to limit the spread of the infection, we need to be able to limit the number of sexual partners that we have, and to be able to have conversations with our sexual partners. Because I think that's another hindrance, that if I do know that I might be having some lesions, I should be able to speak to my sexual partner to say, I've noticed something, I think we need to consult, and maybe we need to abstain. So this is where the abstinence will come through. And post also being diagnosed with monkeypox, we are advocating to say to people, limit your sexual activity, abstain from sexual activity for at least 12 weeks, because there have been studies that have shown that we have picked up monkeypox in semen. At the moment, we do not know whether this can cause infection, but the studies that are ongoing to be able to figure that out. So limiting our sexual partners, abstaining from sexual activity, and using a condom will still be one of the avenues that we use in order to limit the spread of the infection.
So we've spoken a lot about the at-risk group and have focused a lot around sexual activity as a way of the skin-to-skin contact that leads to transmission, and have summarized that, you know, anyone who engages in high-risk sexual behavior, when you speak about hookup culture, from any sexual orientation or walks of life, is at risk of contracting the disease. But there are other modes of contracting this disease that also affect other age groups. For instance, if you look at the WHO situation report, there's less than 1% of the cases of children below the age of between 0 and 17, and in fact 43 cases of children between 0 and 4 years. So what are the other ways of contracting this disease that we haven't perhaps unpacked?
You can have get the infection through sharing of bedding, towels, sex toys, for instance. And I mean, we're just going back to the sexual activity that people might say that they're not engaging in sex, but penetrative sex in that instance, but they're using sex toys, or there's other modes, fisting and so forth. So you will be able to get infected in that way. And I think I also want to bring into the fore the fact that with children, if the mother is infected when they are born, the contact through the canal as they're passing through, that's another mode that they can also get infected. So in these instances, in a household, if somebody is infected, they must also be isolated from the family, because then they could be shedding the virus and it could be in the environment where they are living. I don't know, Johan, if you want to add something.
I do want to add, but I want to add to your initial question, because I just want us to try not to stigmatize people, because we talked about high-risk sexual contact. And at the end of the day, skin-to-skin contact with penetration isn't necessarily high-risk contact. You know, we used to think that only high-risk people would get HIV. HIV can happen to anybody who's sexually active. And I think at the end of the day, monkeypox can also happen to anybody who is sexually active. Yes, right now, we're seeing it predominantly in men who have sex with men who may have gone to venues or sex parties. But as Vanessa has said, you know, someone could have slept in the bed and you could climb in there and you could still get monkeypox. You could literally kiss someone for a very long time and you could get monkeypox. So kissing is not high-risk sexual activity, but if you enjoy kissing someone, you could potentially get monkeypox that way.
I just want to quickly add, I mean, absolutely. Originally, if we look at the historic epidemiology of monkeypox, it's really household-bound outbreaks. So absolutely, sharing of towels, sharing of bedding, even sharing of clothes, sharing of cutlery. So really within the context of the household and the close contact that we do have with our loved ones, even if you don't think about that, there's close contact. That's how we originally understood the transmission routes for monkeypox, and those are still valid. I also wanted to add and just say that it's always about risk, right? And we're having this conversation because there's a high risk, right? We are in the middle, I'm not sure where we are. We're in, hopefully in the middle, close to the end, outbreak of monkeypox. So the risk is high. The virus is circulating, and people should consider that risk and how they can maybe change their behaviors, even if it's temporarily, right? To address the imminent risk the acute risk that we are experiencing now. Who knows how long the outbreak will last, but we do believe that the outbreak, at least in its current context, is controllable over time. So you might find that the risk will reduce, maybe even become close to zero.
I think it's important that we increase public engagement in the messaging that we have. I think it's important that we listen to dissenting views and assess whether that messaging is working, so that we ensure the interventions we put in place will actually have a broader impact. To our viewers, I really hope you have enjoyed this conversation. It has certainly been a very fruitful one, and we'd like to invite you to request for more of these. And if you are part of the at-risk community, or if you have any questions that you need, we invite you to come to our NICD platform. So go to the NICD website, and that is www.nicd.ac.za. Thank you so much for tuning in, and thank you so much for being part of this conversation.